The health district does not identify anyone by name or provide any other identifying information because we're prohibited by law by doing so. And the whole goal is to protect the individual. There have been times where people have been retaliated against because they've had certain diseases. And so we try our best to protect those individuals from having any bad outcomes. So people ask, who can get novel coronavirus? The answer is anybody. There is no particular group that is immune from getting this virus. The symptoms of novel coronavirus are primarily cough and fever. Typically it's a dry cough where people don't have sputum, and typically they don't have upper respiratory tract symptoms. Also a fever, which we define as greater than a temperature of 100.4 or 37 degrees centigrade. So the people that are at higher risk are the elderly. So people in their 80s and 90s have the highest death rate, but anyone over 60 is considered in a high risk category. The other group of people that are at high risk are people that have underlying health conditions like diabetes, like having heart disease or underlying lung disease, and these are the people that need to be especially careful. Coronavirus spreads primarily through what we call droplets. And what are droplets? It's when someone sneezes, little bits of mucus and saliva comes out in balls and then flies through the air and then flies down to the ground. Typically, you have to be in about 5 or 6 feet of someone who's coughing to be at risk to getting the virus this way. And that's why we recommend people stay about 5 or 6 feet apart. The other way that it spreads is people can touch some of this mucus and saliva and then rub their eyes and rub their nose, and then they would get infected. So people may ask, what should I do if someone at home has coronavirus and I don't? Well, again, we recommend social distancing. What that can mean is sleeping in a separate bedroom. It can also mean that the other person be away from the other people in the house if they can. It means being very careful about cleaning up after individuals. And then if someone has, say, a surgical mask, have that individual who's infected wear the mask when they're around other people. So people ask, what should I do if I have symptoms? Well, we would suggest calling your primary care doctor. If you don't have a primary care doctor, it's important to establish a relationship with one so they can evaluate your symptoms and then get you tested. Remember, testing is not done in a vacuum. It's done in collaboration with your doctor who can help you interpret the test and then take care of you if you do happen to be positive. Why can't everyone be tested? Well, the answer is there's not enough tests yet in the United States. And so because of that, we have to preserve the tests for those people who are most likely to have a positive test so we can identify them, take care of them, and also make sure that they don't infect someone else. So why doesn't everyone who tests positive for novel coronavirus have to be hospitalized? Well, we know that only about 15% of the people who get coronavirus really get sick enough that they need hospitalization. That means 80 to 85% of the individuals who have this virus will do just well resting at home and staying away from other people. So many people ask about what's the treatment for coronavirus. There actually is no therapy for COVID. So what that means is people have to wait out the symptoms until they recover on their own. For the most part, what we recommend is people stay home, that they rest, that they keep well hydrated, that they take medication for their cough, just normal cough syrup, and that they take something to help with the fever, either Tylenol or a drug like Advil. A lot of people are asking what's the difference between coronavirus and the flu. And there's several important areas. First of all, we have no vaccine for coronavirus, and we do have one for flu, which helps prevent people getting it and helps prevent people getting sick. Secondly, we have no therapy for coronavirus, where we do have one for the flu, which then helps people who are infected with flu recover much more rapidly. And thirdly, so far, coronavirus has a higher death rate than the flu does. So even though not as many people have died from the coronavirus, it's because not as many people have become infected. And as we see more and more people become infected, we'll be seeing more and more people dying from it. And that's what our greatest concern is that it may affect a lot of people. The fourth thing is that with coronavirus, we don't know what's going to happen. Whereas flu, it's very predictable from year to year. So many people ask, what is social distancing and how do we practice it? Social distancing simply means putting space between you and other people. So part of it is not to gather in groups of greater than 10 people. Obviously, if you have 50 people in a crowded room and someone has COVID, they're more likely to get infected. Another way is, if you are together with people, is stay about 5 to 6 feet apart, so that way if someone does cough, that they won't become contaminated. So many people ask, why did the governor issue the statewide declaration, and how will that help us flatten the curve? Well, right now we're at a point in time when we expect to see cases of COVID increase dramatically. So by increasing the social distancing and decreasing contact with potentially infected patients, that means that less people will become infected over the next several weeks, and will mean that the epidemic will be less severe. How long do we expect this to last? The answer is, we don't know, but it could last a long time. Even after being locked down for several weeks, we'll have to see what the number of cases are. And if those cases continue to rise, we can expect this to go along for a fairly long time, potentially months.